Hey everybody, and welcome back to Blood Matters, a podcast for nurses. I am your host Emma, along with my wonderful co-host Michelle. Morning, Michelle. How are you?
Hi, Emma. All good. All good. Yeah, here we go again. Another
I love it.
podcast.
So today's episode's it's quite an interesting one, isn't it? We've got three guests today, and we're going to be really broaching the topic of advanced nurses' roles within stem cell transplantation. So a little bit like what you do, Michelle.
Yes, actually. I mean, I'm my role, my title is I'm a consultant nurse, and that kind of, if you look at the role descriptors through the Royal College of Nursing and sort of various papers. So it's basically a clinical academic role. So a little different really from the advanced clinical practitioner roles that we're going to be talking to our guests about this morning. But yeah, it's a little different from a lot of ward nursing roles. Maybe it's a role that some nurses might aspire to take on or to have in their career futures. So yeah.
Amazing. And we do have nurses from across Europe for the pod today. So it won't just be about UK advanced practice roles, it will be about roles. So we've got a guest from Germany and we've got a guest from the Netherlands. So we will hopefully show people there's lots of opportunity to take your career further if that is what you wish to do. And hopefully we'll give you some hints and tips on how to do exactly that. And as ever, I've got my notepad ready to write down lots of notes because I always learn something on these podcasts, even as the co-host.
And Emma, talking about different roles though, you also have a slightly different nursing
I do.
role, don't you?
I do. So my role is very focused in education. So I do lots of education and training around stem cell transplants, around JC, and what we need to do as a centre for JC visits to be successful. And also just sort of empowering nurses to feel that they're able to care for patients having had transplants and CAR T cells because they can feel a bit scary, but everybody can do it. Just need to have that background. So yeah, that's me.
Should we introduce our guest
Yeah, I was about
for
to say,
today?
do you want to tell us about our first guest?
Yeah, so we have Daniel, who's been working in oncology for several years now, since 2015, and then since 2020, he's been working in stem cell transplant in southern Germany. So a relative newbie to stem cell transplantation, really. Although he actually started his nursing career in 2012 as a nursing apprentice. And then he applied and he studied applied healthcare sciences in Germany. And then from 2015 to 2018, he worked on an oncology ward. I think that probably gave him his inspiration for working then in stem cell transplantation later, because he was working mainly with lymphoma and sarcoma patients. And then for a couple of years, he changed his focus and accompanied students in applied healthcare sciences as their practice facilitator on the ward. So quite a different challenge, but actually probably really an opportunity for
Oh, for
a nurse
sure.
to look at practice from a completely different perspective. So he was helping them to integrate theory into practice. And then he did an MSc in nursing science, and that's where he first started to be interested in advanced practice nursing. And when he tells us a little bit about his role, it's actually a little different from how we understand advanced clinical practitioner roles to be. And then he moved to Stuttgart to take on a role in stem cell transplantation. And then he's been involved also in CAR T therapy, particularly with an interest again in lymphoma. And then now his focus lies in establishing advanced practice nurse role and nurse-led program in CAR T patients and caregivers. And he's also our our next generation nurse on our EBMT scientific committee. So he joined our group just more than a year ago, or about a year ago. So again, he's a relatively new addition, new recruit into the nurses group of the EBMT, and he's settling really well and has managed to gather a lot of also younger nursing friends through our committee members. So we have a really nice kind of younger nurse, early career nurse vibe within the nurses group at the moment, which has been really, really nice. I certainly learn a lot from them.
Well, we've got him. We're not going to let him go for a while, are we?
No.
Fab. Well, I'll be looking forward to getting some good insights from Daniel. So our second guest is Britt, who actually lives outside of Rotterdam, in the Netherlands. We were in Rotterdam early in the year, so one of my favorite cities, actually. So Britt actually studied nursing in Amsterdam, though, and worked for 5 years as a medium care nurse at the University Hospital of Utrecht. She did do her master's starting in 2020 her master's was of an advanced nurse practice degree. And since then, she's been working at the Erasmus MC Cancer Institute in the hematology department, and her big focus has been on CAR T therapy. With the recent addition of focusing on patients that are treated in phase 1 and 2 trials. So lots of trials still ongoing with CAR T cells. So really interesting that is where she is sort of focusing her work at the moment. And a lot of focus on the experiences and counselling the needs of the patients and the family caregivers after CAR T cells to sort of improve that aftercare aspect, which is probably quite difficult to do, especially if they're not in your centre at the time. So another really interesting guest. And we have a third guest on this podcast. We normally only have 2, but we're really excited to have 3. So, Michelle, who's the third one? I think I hear that you might know her.
Yeah, so Diana Comerford is a nurse I've worked with in my hospital at King's College Hospital in London, although she no longer works there. She's a registered nurse. She specialised in haematology, including blood and marrow stem cell transplant, as well as CAR T therapy. When the treatment really first arrived, she was working at UCH in London again. And she's got experience of being a staff nurse, a ward manager, and then she was clinical lead within an ambulatory care unit there at UCH for patients undergoing transplants as well as CAR T therapy. And then she went into practice development. So she was a sort of practice educator, practice development nurse with us at King's, and did a really incredible job, particularly as we were starting to launch CAR T therapy at King's around that time. So she really looked after the education components on the ward, and made a massive contribution to that. And then she currently works as the deputy head of people development. And, due to her study, she did a master's study looking at advanced practice roles. She also leads that on that within her current place of work. So really looking forward to hearing from all of our 3 guests who have kind of slightly different talents and experiences to bring to the topic. I think it's going to be a really interesting discussion.
Absolutely. So I think with that, shall we get the guests on and get started with the questions?
Indeed.
All right. Well, our guests have arrived. Good morning, everybody. Thank you so much for joining us today. How are you doing?
Good, thank you.
Excellent.
Thank you. Thank you.
Excellent.
Lovely.
Shall we bolt straight in, Emma?
Let's do it. Do you want to take the first question for Daniel?
Yes.
Yeah, why not? So Daniel, I'm going to start with something really easy for you. Please tell us about your current role in transplant nursing.
Yes, of course. I currently work as an advanced practice nurse on a hematological oncology ward, and what we do is stem cell transplantation and CAR T cell therapy for some months now. And my hospital has been developing APN roles for several areas for a few years now. And I was one of the lucky ones to have the opportunity to develop an APN role as one of the first master degree students in our hospital. And APN roles are something quite new for the German context. We didn't have it, I think, until 3 or 4 years now. So it's really a new topic, and that's why it's quite tedious at the moment to establish these roles, because no one really knew about it. So, but basically I have been in my role since last autumn, and my current key areas are still direct patient care. I am involved in the promotion of nursing professional development and the promotion of the interprofessional collaboration. And one new part now is the cross-site and cross-national networking. So that's why I got to know the EBMT, and now I'm involved in it too. Basically, my role is split in 2 parts. I have office days, and I am still working on fixed days on my ward in direct patient care. And my office days give me the opportunity to develop right at the moment my first big project to develop a nursing care model for CAR-T patients. And the goal in it is to offer nursing support from the first mention of CAR-T cell therapy in consultations with patients until the follow-up care of CAR-T cell patients. And there we want to have a follow-up care by telephone, so patients make a safe and sound transition from hospital to their homes. And even the caregivers are involved in this too. So I think we will develop a very good system to make sure that they are really going home safely and feel secure, and they have a contact person in the clinic which can be reached easily. And on the other side, I have also team-related tasks. For example, we have weekly trainings for our staff, and I do it with a physician together. So basically it's to educate and train the staff. And with regard to the interprofessional cooperation, I have been conducting interprofessional case discussions for over a year now, and we discuss quite difficult patient situations or social situations which seem difficult to the staff, and we will further this development. So we have all the professionals involved in patient care in these interprofessional discussions. So basically these are my main tasks at the moment.
And so, Daniel, the APN role, that's advanced practice nurse.
Mm-hmm.
Yeah. So that sounds very similar to like a kind of maybe practice, clinical practice facilitator, sort of educator, with some kind of direct nursing care roles on the side of that, and perhaps a little different from the advanced clinical practitioner roles where nurses are admitting and discharging patients and doing ward rounds. So it's great that there's another level or another layer of career path for nurses to travel down, while that still enables them to develop and gather more experience in some areas. And it seems that really fits with your the APN role really fits with your experience, sort of having sort of major introductions already at the beginning of the pod. It seems that's almost your career was leading up to this point to do this APN work. So that's really fantastic. I'm going to hand over to Emma now to ask you the next question.
I mean, I'm not sure how you have the time to do this next part of your role, but I was going to ask you about your role with EBMT. So you were appointed within the last year, I think, wasn't it, as the next generation nurse? So can you tell us a bit about that, and how do you squeeze that in to your week?
Yes, that's a good question. So simply through a contact in Germany who's also involved in the EBMT, I got to know the call for applications, and I applied without a further ado because I think it was a very good opportunity to engage more in the field. And yes, here I am. So the role basically was established in the nurses group to reflect early career nurses in the group. And most nurses in the group have many years of professional experience. So the nurses group took the opportunity to also give the next generation nurses, so early career nurses and those who have been in the field for a few years now, have a permanent place so they could be seen and contribute with their views, their needs, and also their requirements. And the role gives me the special task to set up a group of next generation nurses via social media, and I am responsible for it to grow. And just like I said, we will start next week with active posting in this group. So I'm really excited about this work, and I'm really curious how it will work out. So the group is also there to simply get in touch with early career nurses and to learn even more about what keeps them busy and challenged in their everyday professional life. And on top of that, I'm actively involved in the program for the annual meeting in this role. And it gives me the opportunity to contribute to the content of the educational meeting. So that's quite exciting. And exactly for this, and I'm really looking forward to it, we will have a next generation session at the annual meeting in Glasgow, and in which we will highlight special challenges, especially at the beginning of the career, from the perspective of younger nursing professionals, and then discuss them together with the audience. And we have come up with something really special to get the whole audience involved in the discussion, but I don't want to give too much away on
No
this.
secrets.
So basically the presentation will be about topics like work-life balance and social media and care and professional care especially. And we will hear something about the special relationship of young professionals and young patients. And I think you can all really be excited about it.
Oh, we are. We are. I think people should look out at their comms for their communications from the EBMT for some of that information. So I'll pass you back over to Michelle, because we're just going to kind of one at a time with the questions as we've been doing. So Michelle, you've got another one for Daniel.
Yeah, I just wanted to ask you another question about what you just said, Daniel. You referred to a group. Is this and social media? Just tell us quickly about what platform you're using and how people might find that group.
So we are located on the LinkedIn page, and we have a group which is called Next Generation EBMT Next Generation Nurses Group. So everybody's free to join, and even not next generation nurses are welcome in this group, just to enrich discussions on the specific topics and to get an intergenerational exchange in this regard. So we will look forward to have more nurses in this group.
Thank you. Thanks, Daniel. And, you've already done a lot in your career, and, you're in this fantastic APM role that clearly is sort of at the beginning of that, and you have a long way to go. But what's your future aspirations? Where do you want to go from here?
Well, that's a really good question and a quite difficult question. But in Germany, we don't have no clear professional paths for nurses with a bachelor or a master's degree. So we have these career paths in management and in education, but the professional field is very young still. And my next goal is the completion and implementation of the CAR T-cell therapy nursing care concept. So we will work on that. And I would like to achieve that this concept can be transferred and adopted in other locations. So it will be easier there to establish APN roles. And basically, I think I will kind of settle down in this topic area and of cellular therapies, so to speak, and to delve further into it. And one of my goals in the next 2 to 3 years is to get a PhD position where I can dedicate myself exactly to this exciting topic. And in the future, I can also imagine working in a university in the field of teaching in order to focus on university teaching and practice. So, for example, supervising students and providing professional guidance on academic trained nurses. And one of my desired long-term goals is, I think in my plan, it's around about 2040, I will have a 3-part position where I have 1 part research, where I have 1 part teaching, and 1 part is still direct clinical practice or direct clinical patient care. But if this will be possible, it's hard to say if this will be possible in Germany in this time frame.
Excellent. I'm going to hand back to Emma now.
I'm in awe. That is an amazing plan, Daniel. I'm very impressed. I also would like to get my PhD, so maybe we'll be PhD buddies at the same time. I'm going to bring this back to the early career nurses that you were talking about just a few minutes ago. What are the main challenges, do you think, for early career nurses now? So the ones that are coming into the job now or are only a few years in, what are their challenges?
I think there are many challenges, and I think they are located in different areas. I think to look on a ward level, I would say one of the big challenges, not only in 2023, but also in the following years, is simply to keep an overview. The development of cytotoxic substances, cytostatics, antibodies, today disjoined by numerous other therapeutic approaches. And just to put it bluntly, I think 20 years ago, 10 different substances were used in 10 different patients. Today, 10 different patients have 10 different types of therapy. So we have classic cytostatics, we have antibodies, we have autologous and allogeneic stem cell transplant, sometimes combined with radiation therapy. And until now, this also was associated with a relatively homogeneous picture of side effects, which were mainly limited to mucosal toxicities. And today we have targeted therapies with very individual side effects. We have CAR T-cell therapies. Suddenly neurologic symptoms are appearing. And then for sometimes we have antibody drug conjugates, we have bispecific antibodies, we have small molecule therapies and viral therapy, which is really new to the field. Then we have approaches of personalized vaccinations, we have gene editing and microbiome therapies. And I think the mass of novel therapies can be kind of intimidating, especially at the beginning of a career, because the diversity of the therapies themselves and also the diversity of side effects really raise the expectations on our competence. And nevertheless, everything can be learned, and I think no one expects you to master everything perfectly right from the start. But I think most nurses will have to step back and to learn one therapy modality after another, so not to get overwhelmed. And I think especially those novel therapies, at least initially, sometimes bring with them ethical issues. So, for example, funding or the availability of therapies in different locations is quite challenging for some populations. And I think here it can be challenging to build up and maintain the emotional resilience and ethical engagement with these issues, and especially with the focus on maintaining one's own well-being. I think this is one really important challenge. And on a more abstract level, I think younger nurses are in particular confronted in the future with, or at least in this year, with crisis and war. So especially because of the current political world situation, in my opinion, there has been no really good and comprehensive solution for supporting people from crisis region, from another country, in another language, when they have to go to a hospital. And this means we can meet people who have both psychological burdens due to the diagnosis of cancer alone, but now possibly have also additional psychosocial burdens, or even find themselves in existential crises because of the crises themselves. And I think the plethora of demands that arise from these aspects might be overwhelming as well in the beginning of a career where you are looking on learning how to perform the therapies securely and safely for patients, and the learning processes in these psychosocial regards is something that takes time, and the burdens are adding up to another. So I think this is one of the biggest challenges, at least for the next 12 months.
I absolutely agree, and that probably leads us nicely into saying that we are focused on the psychological well-being of our staff as well. So we are going to discuss that on another episode.
The last question for Daniel: what ideas do you have for senior leaders to address the challenges that early career nurses experience?
Basically, I think senior leaders must have the openness to take on those problems of younger generation nurses, and take those simply as seriously. I think it will be very beneficial if senior leaders promote the exchange between different age groups and point out which common goals and common topics there are, because I think most topics are not only focused on younger generation. So every generation is involved at least in the solution of these problems. And I think the leaders have the very difficult task to look at the common topics and to bring all groups together for a solution finding process. And with regards to the overview of various forms of therapy, I think appropriate educational offers must be made available for every nurse to take place. And so, and in my opinion, this is connected to the aspect that it must be defined what demands are actually placed on new nursing professionals. So who has to know what, to what extent, in what time frame. So everyone is clear about that younger nurses are not lazy, or they are not interested in the field, but they have to have the time to learn all these different aspects of their professional career. And I think both the framework conditions and the target conditions must be presented so that nursing professionals can orient themselves on it. So I think in addition, there's a trend towards the aspect that new employees want to feel good in their work and want to have a work that gives them purpose. And I think the best way to do this is promote an open discussion on these common interests and the common vision for the next few years, the next 10 years, the next 20 years. So everyone can get involved in the actual shaping of this vision and to make them feel integrated in this development process.
Thanks so much, Daniel. Thank you. Got some great insights there. Thanks so much for sharing all of those. I'm going to hand back over to you now, Emma. I think we're going to bring Britt in.
We are. Stay where you are though, Daniel, because we've got some quick fire round questions for you later on. But thank you very much. Hi, Britt. Thank you very much for joining us today.
Thank you.
Just to start it off, really just a straightforward question. What do you do? Can you tell us about your role, please?
Thank you for the invitation. My role, I work mostly in the outpatient clinic, the hematology department as well. And my main field of attention is CAR T-cell therapy. Mm-hmm. So I see the patients before their treatment. So I provide them with the information. And I also take informed consent for the treatments. And then actually together with the hematologists, you see them 1 week, another week, and another week I see them in the time before the CAR T-cell therapy. And in that time is mostly important to provide all the information they want, all the questions they have. There's a lot of insecurities in the beginning. And also, of course, it's a time where you really need to be aware that it's possible that patients can get progression and they need bridging therapy. So this is also a role for me there. And then after the CAR T-cell therapy, I see them back on the outpatient clinic. And this is more I try to have more focus on the aftercare, what they need. So again, you see them together with the hematologist 1 week and another week. Sometimes when it's going well, you can see them less often, but still, I always try to be low key available for practical questions also. So with small insecurities or practical insecurities, they can always reach out to me. And this is the role I have towards the CAR T-cell therapy. And I also, since a short period of time, have a focus on phase 1-2 trials. And this also entails the CAR T-cell therapy a bit. So in that, I see also the clinical patients in the clinical ward and have also more a role there when they are admitted in the hospital. So then, sometimes I see actually the whole process. So before, during the admission and after the admission, which gives a even better overview of what they are going through. So this is mostly my work, and aside of that, I give some education, mostly on the wards, so to the nurses that work on the ward, or the nurses that do the hematology education, to give education about CAR T-cell therapy and what they need to be prepared for. And also, I'm trying to publish an article. We're busy with research in the same time, because I'm not graduated so long time ago. So this is something that you try to do aside of the job, and this gives also other challenges. So this is mainly my role in the moment. Yes.
So you're also very, very busy. Very, very busy. What's the title of your role in Holland, in the Netherlands? What do they call you?
I think translated, it's nurse specialist.
Okay.
Yes. So but it's the advanced nursing practice education that we do. Yeah.
Sure.
Yeah.
I find it so interesting that we all have different names for different roles, but a lot of them are very, very similar. I just find I was very curious. So Michelle has your next question, so I'll hand you over to
Yeah.
Michelle.
And that was going to be also my question. So it's very much like a specialist nurse, specialized nursing role that you're carrying out with the patients on a day-to-day basis. I think that's probably I think your translation of that is really helpful for me. So why do you think nurses should take on more specialized nursing roles?
I think it gives you more depth into your role as a nurse. You can more specialize into a more specific field. And then you also have more medical background into that field. You extend your role in that field. And you have a better overview of medical support aside of your nursing role that you already have experience in, because most people work as a nurse before, so
and I guess it enables us to provide a greater depth of care for the patients as well, isn't it? That I think it sounds like you're very well connected to your group of patients, that you're their person. They come to you for information, they come to you, they know that you're there when they're going to be in the clinic. They can call you when they go home if they have questions, and you're like a key provider of information and a kind of really key link in that pathway that the patients experience during that period of care. So it's really important. Do you think the level of recognition for these advanced roles, these more advanced roles, is appropriate, either professionally? Do we get the professional recognition or the financial recognition that goes along with the additional training that happens, the additional responsibility and autonomy that we absorb in our practice?
Yes, I think professionally it gives you a lot of opportunity to develop yourself. So aside of the patient care, you have different pathways you can choose, as Daniel was describing as well. I think it's a bit similar to the Netherlands, that there's not one clear pathway, but you can choose your options. It is expected that you do a little bit of education, but also maybe if you are interested in improving care, it's also possible to see where you think it's necessary and then to set up that. So you have a little bit of freedom in how you want your career to look, and I think that is something that is very nice to choose, for example, an advanced nursing practice role. But also, if you are more interested in research, you can have more attention towards that field. So in that way, professionally, I think it's very challenging, and therefore, a very nice job to choose after your nursing experience. Yes.
Thank you very much, Britt. I'm going to hand back to Emma.
My next question is really about, what does that pathway for career development to become an advanced clinical practitioner look like in the Netherlands?
Yeah, so you study you study nursing actually first, and then of course you do the education, a Master of Advanced Nursing Practice, and then from there you have different kind of pathways to follow. So you can add more education if you want into a specific field. You can have more focus on the research, and for example, what we were saying before about the PhD, and also to work more into that field. You can also start to work indeed in a university, but then it needs a little bit more of education into the into the educational field. So in this way, you can follow your path.
Amazing. So master's level study is very desirable, which I think most of you probably have or have worked towards. All right. So we'll come back to speak to you as well, Britt. We're just going to move on to the very patient Diana. Thank you for waiting, and I'll get Michelle to ask you the first question, if that's all right, guys.
Hi, Diana. Can you tell us a bit about your current role, please? And kind of just by way of moving into your section.
Sure, no problem. So I'm the Deputy Head of People Development at Homerton Healthcare in London, England. And one of my main work streams is to lead on the advanced practice agenda within the hospital. And I basically make sure we have the right governance and support structures. So basically that we're doing enough to have the right quality assurance for advanced practitioners, for our trust, our practitioners, and also to our patients. I care quite a lot about job satisfaction and professional autonomy within advanced practice because it was the basis of my dissertation. So I tried to incorporate this into my work agenda so we can make improvements to what we're doing to make sure we retain that expertise. My other work stream is clinical education, which fits into practice development and also career pathways, which can potentially lead into advanced practice. So they both kind of fit nicely together.
That's great. It sounds like it plays to all the strings of your bow and, has enabled you to develop the stuff that you're really interested in and incorporate that within your career, which is brilliant, and that's probably what everybody wants to do, right? To have the opportunity to incorporate the things that bring them joy into their daily work. So that's fantastic.
So interested. I also think it's brilliant to have your perspective from a sort of slightly different role, but such an important role. So I'm going to ask you to really break this down and ask you to tell us the main differences between a specialist nurse and an advanced care clinical practitioner, and then also an advanced clinical practitioner and a physician's assistant. They are a little different, aren't they?
Yes, so I'm familiar with the term physician associate. So I'll break that down afterwards. Sure. So I've never been a clinical nurse specialist before, but from my observations of working with them, are that CNSs and ACPs likely have some overlap. Because as a clinical nurse specialist to an advanced clinical practitioner, that's potentially a career trajectory should someone wish it to be. Both clinical nurse specialists and ACPs are specialists within their own areas. So maybe a clinical nurse specialist is a key worker to their patient, making sure that patient continuity is there, often from diagnosis onwards. And advanced clinical practitioner, the addition to that is that their practice is characterized by a really high degree of autonomy, complex decision-making across 4 pillars of practice, which are clinical, leadership, education, and research. We should be using advanced practitioners for innovative roles that complement a service. So, for example, decreasing patient waiting times, preventing hospital admission, improving patient pathways. And their level of decision-making is what enables them to do this. Physician associates are a completely different role. Their training is generalist and very practical, and I'm not sure that they're required to have any prior healthcare experience before they start training. They're usually supervised by a medical person, and because of their training and scope, they tend to be able to work in multiple areas because of the generalist nature. Now, an advanced practitioner will have had the experience of working in healthcare since the registration. They will have the networks, the links within a healthcare setting, and the specialist knowledge that is underpinned by theory and with really specific knowledge and skill competencies. And their supervision can also be multi-professional. So you could be a nurse and be supervised by a medical person or another advanced practitioner. And it doesn't have to be a nurse. It could be an allied healthcare professional. I think each role has something different to offer, but they should be utilized in the right way so it suits the service and also patient need.
So it's this big multidisciplinary team with lots of training that's got the patient at the very center, which is fabulous. I knew I would learn something today.
I think it's really important to point out that oftentimes these three roles are kind of like pinged against each other.
Yeah.
But we have an international healthcare crisis. I think we have to have like different routes into healthcare. But ultimately, I just think it's about the right role in the right place. That's the most important.
Amazing. So Michelle is going to ask you your next question.
Yeah, thank you, Diana. I really enjoyed those insights. I think that really helps to clarify some of the sort of myths around the roles, and the sort of almost exclusionary conversations that we have around these advanced or advancing or more progressed nursing roles, that you can either be one but you can't be another.
Yeah.
And actually there is a progression, there is a path. It's not, oh, you wanted to be a specialist nurse 1 minute, but that means that if you've chosen to be a specialist nurse, that means you can't be an advanced clinical practitioner. It's kind of, it's not an either or. Those are complementary roles along the whole career trajectory of nursing. And I think that when you look at medical careers and you look, there's very linear progression. There isn't really, once you've chosen your speciality, you don't really diversify a lot from that. You're a trainee, you go to medical school, you're a trainee foundation doctor, you're then a specialized doctor, and you do your training, and then you become a consultant. And that's your career. I think there's a lot of talk around nursing careers, which also gets kind of a bit embroiled with the nursing hierarchy and pay structures, which isn't necessarily about career development and job satisfaction.
No.
And I think those are complex entities that are really difficult to tease apart. And I think when nurses talk about careers, and I think both Daniel and Britt have really highlighted this in their responses when they've talked. They talked about, kind of using the components of what they have done as nurses already to build this structure around their career development and professional and personal development. And when we asked Daniel about, or Britt, I can't remember now, the question about financial recognition, we attach the financial recognition to components of roles, but that financial structure doesn't necessarily quite exist to match the autonomy and responsibility that nurses take on. But then it doesn't necessarily with our medical consultant colleagues either. If we were to look at career parallels, yes, you get paid extra things for doing extra bits for doing extra things, but a basic consultant salary just increments year on year like a nurse's salary will. But I think we have this very hierarchical structure within pay structure, certainly within UK nursing, that feels very much like a barrier to progression rather than a facilitator. What do you think that are the main sort of educate? Do you have any thoughts on that, Diana, actually? Sorry, before I move on to the next question.
Yeah, I do. I think one of the positives that we really have to take away from this conversation is that, nursing isn't linear. We start off as, staff nurses working, potentially in a clinical area, but I've been in management, I've been in education, I've gone back to doing something that's both. I think that the diversity in terms of the roles and what the potential options are is amazing, because I don't think we see that in a lot of other professions, like in a lot of professions, even outside of healthcare. So, you know, like I would have options to become an educator in a university if I wanted to. I could have gone directly into more management routes. You know, so I think to have those options is amazing. I could have become an advanced clinical practitioner while I was still in hematology. You know, so to have those choices is actually really lovely, and it's something that we should be selling.
Yeah, rather than using them as a stick to almost beat people with. Yeah, absolutely. Thanks, Diana. And so main education and training components for advanced clinical practitioners. I know Daniel and Britt have both talked a little bit about that, but it'd be great just to hear about your kind of ideas around that framework.
Okay, so my experience obviously is from England, so it may like vary across like different countries in terms of like our training components. The programs usually consist of modules that cover the 4 pillars I mentioned before. So you'll probably see like advanced assessment, research modules around like evidence-based decision-making, non-medical prescribing, which may not be for every role because some professions aren't allowed to prescribe. So when we talk about advanced clinical practice, I know like we have been, we've had a focus on nursing, but you know, allied healthcare professionals can also be advanced practitioners. And there will be modules around education and leadership as well. And as Britt mentioned before, the award to this is a Master's of Science in Advanced Practice. Depending on the program or the route, trainees are usually required to achieve like a certain number of practice hours, usually around like the 500 mark, depending on the route. On top of that, they have to maintain a portfolio to make sure that their training is aligned to what their specialty needs are. So you may have like a very generic ACP program, but maybe someone is specializing in learning disability and autism. So their portfolio would need to align to that. They are required to meet with their supervisor regularly, at least 1 hour per week or more if needed. It's a very hefty program that requires a really high level of support from the organization and their line managers, so that we make sure that, you know, trainees continue to stay in the program and receive the development that they need.
Amazing. Thank you, Diana. It's really helpful just to kind of sum that all up really and offer that some context. Over to you, Emma, for Diana's final question.
Final question for now, yeah, for the quickfire round. So there's a lot of writing about ACPs, and often it's comparing those people with it in that kind of role as you know, making this comparison. Are they mini doctors versus maxi nurses? So what are your thoughts on that expression, and also what are the merits of being an advanced nurse then?
Okay. I haven't really heard of the term maxi nurse used that often. Is that an American term? I feel like I should know this because I'm Canadian. But yeah, I've not really heard this term used a lot. I wonder if it's like an older term that was used to move away from the term mini doctor potentially.
Maybe, yeah.
I have, however, heard of the term mini doctors used, and people often ask like, oh, what is the difference? Are we trying to replace doctors? And I think the use of this term is very careless. We have ACPs that train junior doctors, and ACPs are a role within their own right. One of the key things that will really impact someone's job satisfaction is the lack of clarity and understanding about what advanced practice roles do. And terms like this show just how much people who use them misunderstand what ACPs are capable of, or are potentially misusing ACPs for tasks like clerking and just discharging patients, which actually isn't maximizing their capabilities at all. So I think that's probably where the term mini doctor potentially comes from, because that is how they're being utilized. We also can't forget that, as I mentioned before, that it's not only nurses that can be advanced clinical practitioners. You have the whole allied healthcare professional group that are doing amazing things that I know of in my workplace. And one thing that advanced practitioners have that doctors do not is permanency within an organization. So when a doctor is moving into the next rotation, it's the advanced practitioner that is there maintaining continuity of care. I also mentioned this before. Many nurses, midwives, allied healthcare professionals will have worked years, if not their entire careers, potentially in one hospital. And the networks and the knowledge and links that they build up to work across the whole organization is immeasurable. Their ability to form partnerships with individuals, families, carers, and their colleagues is what makes advanced practitioners so special. And that is what allows them to become innovative, because they understand all the workings of their organization. We have a shortage of healthcare professionals, and we should be respectful to what they're called. So whatever job title it is that we're using, and words matter, and terms like this have stuck and contributes to the lack of understanding of what they actually do. So I think that there's probably some work that needs to happen around profiling the roles a little bit better. I know that where I currently am, there's a lot of work that's currently happening. And I think the appreciation for advanced practice is growing at the moment.
I'm glad. Yeah, it's a very ignorant term, really, isn't it? Mini doctor. It says that advanced clinical practitioners are, oh, well, but you're not as good as a doctor, which is completely inaccurate. And they do stand in their own right as very useful. And as you say, that continuity is the important thing for the patient, isn't it? You know. Grant, well, thank you very much for that, Diana. I think you've probably given us our closing very easily in that last wee sentence. So what we do now, you guys will know this because we've told you already, but for anyone that's not listened before, we do a little quick fire round. So we have just 2 more questions to ask all of our guests, with the aim that it's a 1 or 2 sentence answer, very, very quick, very short answers, just to get people thinking. So we do we'll ask the question, and then we'll go across the guests, and I'm going to pass over to Michelle to ask question number 1 of our quick fire round, and then I'll ask question number 2.
So I'm going to stay with you, Diana. What do you think needs to be done to attract and retain more people in nursing careers?
I think earlier someone mentioned well-being. I think when we talk about well-being, that this isn't always monetary, although that really helps. I think the appreciation should be genuine, in that our policies reflect the things that will contribute to our work-life balance. So, for example, making sure that we have appropriate time owing to give back to people, that we set things that are in place that enable nurses to, have their breaks, leave work on time, and really think about that retention piece, asking them what it is that they want, that there's time for development, that those study leave hours are honored and supported, because otherwise people are just working and burning out. And I think that's a really, really tricky place to be in. Daniel mentioned earlier about the number of competencies that a hematology nurse needs to know. One of the key problems is obviously because of our shortage. It means that the people who support those in early careers is also less. So I think being able to retain our really experienced staff is so important to avoid that turnover of staff in the newly qualified group.
Thanks so much, Diana. Moving on to you, Britt.
I think that, as we talked about before, that it's important to profilate the role as a nurse practitioner, so that for everyone it's clear that it's an independent role for everyone that is working in the hospital, but also for the patients, so they also have more knowledge about what your function is, because this I also see sometimes that patients are confused. Oh, but are you the doctor, or what are you? So I think maybe from the government or from the education in the beginning of nurses, you can have already more attention towards that. So which the path of the nurse practitioner is an independent work in group. Yeah.
Thanks so much, Britt. And on to you, Daniel.
So I totally agree with what Britt said, and just one thing I can add to that is that we have that we need leaders who facilitate this process, and not only in the hospitals themselves, but on a regulation base. So we have good structures for new roles, for emerging roles that are needed in the future, because patient populations will change, and by the development of new therapies, new needs will arise. So we'll have to have a system that will can adapt to these future needs and requirements on healthcare, and especially on the nursing profession.
Amazing. Thanks so much, Daniel. Thank you. Emma.
So one last question for our wonderful panel today. So I would like to ask you, what is one piece of advice that you would give to any nurse that is looking to apply for and train for these types of roles? And I'll start with Diana again, and we'll go back in that order.
I think one piece of advice I would give is making sure that you have true support from the people that are putting you through this program. So whether that is your line manager or actually the people who have the true influence to make sure that they will be able to practice at that level when their training is complete. Because I don't think there's much more demoralizing than spending 3 to 4 years training for something that you then don't get practice in. So really understanding what that job role will look like at the end. And obviously also to make sure that they have that support during their training years to do the things that they need to as part of their program.
Thank you very much. And Britt, what about yourself?
I totally agree with what Diana said. Yes, and I think one advice also is to be a little bit patient in the beginning, because it takes a long time to really feel comfortable in a field and to feel comfortable in your new role. In the beginning, it's mostly educational, and you need to know a lot of things, and it's very different than your nursing role. But then, after the years pass by, it gives a lot of opportunity to develop yourself in your new role.
Lovely. And Daniel, what about you?
I think my piece of advice would be to do as many work shadowings as you could do possibly, because this gives you a comparison and a feeling for where can I work in a really good environment, where do I have leaders who support me, where do I have teams that accept me, and where do I have the resources which make my work even possible, or even accelerate my work. So I think this a small analysis of my work environment is very essential in this regard.
Brilliant piece of advice. Well, that brings us to the end of this episode of the podcast. I would like to extend a very, very grateful thank you to our 3 guests today. It's been really interesting and really enjoyable to hear you have so much passion for your work and for advanced nurses roles. I don't know if Michelle wants to add anything to that, but thank you so much, guys.
Thanks for having us.
Yeah, no,
Thank
thank
you.
you very much, all of you. It's really been a pleasure. And, although we had the structure of the questions, I think we've really drawn out a lot of information from you guys that I wasn't necessarily expecting. So I hope that you've enjoyed the experience of joining us on the pod today. And we look forward to hopefully welcoming some of you, if not all of you, back at some point in the future. Thank you.
I look forward to it.
Thank you very much.
So Michelle, how interesting was that episode?
Yeah, absolutely fascinating. No, I love that. It's and a really a very much needed discussion topic, I think, because there's a lot of stuff in the pod today that I think can be really helpful for nurses, sort of when they're considering these sorts of roles that they are within reach. But some very, very clear advice around ensuring that certain resources and support structures are in place before embarking on those roles, to be able to execute them and the training for them successfully. So no, I thought it was fantastic, and a great combination of guests coming from different backgrounds, different experiences, and bringing a whole variety of stuff to the pod today. So I really loved it.
Yeah, I think we definitely managed to dispel some myths around about advanced nursing roles and advanced clinical practitioners, and hopefully maybe some people have some ideas about what they can take into their own areas, and as you say, where do if somebody wants a career development, where do they go, how do they do that? So really, really good to see that there's lots of opportunity, and hopefully people have maybe picked up that maybe the name's a little bit different in their ward area, but actually these are roles that are seen across the world and that people are in, and that they are achievable.
Yeah, exactly. That feels like a really good end to place to finish.
Doesn't it just? So on that note, thanks very much for joining me again, Michelle. As
thanks
always,
again, Emma.
It's a pleasure. I would like to thank the background team for doing all the wonderful editing magic that they always do for us, so that Michelle and I don't have to stress about the IT aspects of it. If you have any suggestions, you'll hear us say this every podcast, please do get in touch and let us know what you would like us to discuss. So we do like this to be as you-driven as possible. And thanks very much for the listeners who've joined us today. And if you are looking for anything around and about advanced roles, go for it, guys. Do not be shy. Try and find what you can do. Thank you so much, and take care of yourselves.
Thank you.